A very good afternoon to you all, and welcome to the class. The class is on the lymphatic system. Okay, first you have to know what do you mean by lymph. Okay, what is a lymph? A tissue fluid, otherwise called as an interstitial fluid, that enters the lymphatic vessel. When you look into the body, I told about there are two vessels in the presence in the body. They are called arteries and the vein. There is one more vessel or channel present in the body that is called as a lymphatic vessel. So the tissue fluid, otherwise called as interstitial fluid, that enters the lymphatic vessel. Okay. So you can see in the figure here, see this is the arterial system and this is the venous system. Okay, so the larger particles or the macronutrient, they cannot enter the venous channels. Okay, they enter through the one more system channel that is called as a lymphatic vessel. So this is the channel you are seeing, the green color, they are called as a lymphatic channels. Okay, these are the lymphatic channel. So the lymphatic system, what it consists of? Lymphatic system essentially a drainage system accessory to venous system. You know the venous system, I told the arterial system, the blood flow, tissue, then it flows through the drainage system to venous system, then it reaches the heart. So it is the same way, okay. Essentially a drainage system accessory to venous. So what do you mean? The larger molecules or the macronutrient which are not able to enter through the venous system will enter through a one more system that is called as a lymphatic system. So essentially a drainage system accessory to the venous system. You see they are accessory to the venous system. They are called as a lymphatic system. So next. Okay, see, larger particle that escape to tissue fluid can only be removed via the lymphatic. Means the larger particle which are not able to enter through the venous system, they all enter through the one more system that is called as the lymphatic system. So larger particle that escape into the tissue fluid can only be removed. So the larger particles can only be removed through this system that is called as a lymphatic system. So no, lymphatic system where the larger new molecules can only be removed out. Okay. What is the function of this? A function of the lymphatic system, if you look, reabsorb excess interstitial fluid. That means returns into the venous circulation, maintains blood volume level, prevent interstitial fluid level from rising out of control. Okay, transport dietary lipids. These are called as lacteals, which are present in the small intestine. Okay, transported through lacteals, drain into larger lymphatic vessel, eventually into bloodstream. So this is a function of the lymphatic system. So it will go through the venous circulation and prevent interstitial fluid levels from rising out. Okay, then lymphatic system is the development of the lymphocyte. So the immune system of the body is done by this system, that is a lymphatic system. Okay. So next we'll look what are the components of the lymphatic system. What are the components you see? Lymphatic vessel. Lymphatic vessels are lymph capillaries. You can see the small capillary. These are the green color one. They are all lymphatic vessel you are looking. Lymphatic vessel, lymphatic trunk. There are major lymphatic trunk, lymphatic ducts. These are the lymphatic vessel. Okay, lymphatic capillary, lymphatic vessel, lymphatic trunks, and the lymphatic duct. Okay, there are the lymphatic organs. Okay, the lymphatic organs present in the body are thymus, lymph node, spleen, and the tonsil. These are the lymphatic organ. So the lymphatic organs are thymus, lymph node, spleen, and tonsil. There are lymphatic vessels also. Okay, now look. Lymphatic vessels consist of lymphatic capillaries, lymphatic collecting vessels, lymphatic trunks, lymphatic ducts. Okay, these are the how the it goes. Okay, so the smaller thing you see, the lymphatic capillary. From the lymphatic capillary, the fluid will pass through the vessel called as through the lymphatic vessel. Then it goes through the lymph node. From the lymph node, it will go to the lymphatic vessel, then the trunk, the larger one, then the collecting duct, then it will go through the vein, the larger vein. You will see that is called as the subclavian vein. From there, it will drain into the heart. Okay, lymph. What do you mean by lymphatic capillaries? You see see here. This is a venous end. Okay, venous end. This is the arterial vein. Green color you can see. They are all lymphatic capillary. Okay. Features and of structure: blind end, single layer of overlapping endothelial cell, more permeable than that of blood capillary, absent from avascular structure, brain, spinal cord, splenic pulp and bone marrow where they are absent. Okay, lymphatic capillaries also called in some region there are presence of the lacteals. Okay, the small intestine contains special type of lymphatic capillary called as lacteals. Lacteals pick up not only interstitial fluid but also dietary lipids and lipid soluble vitamins. Lymph of this area have a milky color due to lipid and is called as chyle. They are called as chyle because of the color, okay, like milky color due to lipid present in them, so it is called as chyle. Okay, next. Okay, we'll look what do you mean by lymphatic vessels. Okay, what are the lymphatic vessels? You can see here, these are all the black color one, what you're seeing, they're all lymphatic vessels. Features and structure. Three-layered wall but thinner than the vein. More numerous valves in vein. Interposed by lymph node at intervals, arranged in two groups. Okay, there are superficial group of lymphatic vessel and the deep set. There are two sets are present, arranged in superficial and deep set. Okay, there are trunks called a lymphatic trunks. So the lymphatic trunks are first one, right and left jugular trunks, right and left subclavian trunks, right and left bronchomediastinal trunk, right and left lumbar trunks and the interstitial trunk. Okay, these are the lymphatic trunks you are looking. It is according to the region wise they are named. Okay, lymphatic duct. Okay, there are two group of lymphatic duct called a right lymphatic duct. The right lymphatic duct is formed by the union of right jugular vein and right subclavian vein, and this is what you are seeing, that is called right lymphatic duct. End by entering the right venous angle. Okay, right lymphatic here, right lymphatic duct. You are seeing this. Okay, right subclavian vein, right jugular vein forming into right lymphatic duct where it drains. Okay, thoracic duct you see begins in front. You can see this is the larger one. What you seeing, that is the thoracic duct. Begins in front of L1. L1 means L1 lumbar vertebra has a dilated sac. You can see this dilated sac called as cisterna chyli. This dilated sac is called as cisterna chyli, formed by right and left lumbar trunk. You can see they are formed by right and left lumbar trunk and interstitial trunk. Enters thoracic cavity and ascend, travels upward veering to the at the level of T5. Here, okay, at the level of T5, you see this is the level of T5. At the root of the neck, it turns laterally, arches forward and descend to enter the left venous angle. Same, okay. Where it will be joined by, see here, it will be draining into the two channel. One is left interjugular vein and the left subclavian vein, and at the angle between them is a, you see the thoracic duct. Okay, before termination it will terminate. Okay, it will terminate at before it receive into right jugular and the subclavian vein. This duct what you see here, it is called as a thoracic duct. Okay, drainage pattern. If you see a body, the drainage of the part, okay, this part, okay, till here, it drains into the right lymphatic duct, and all the other part, this whole part will drain into the thoracic duct. So remember, right drainage pattern, it will drain into right lymphatic duct and thoracic duct. So if I tell right lymphatic duct receive lymph from, what all the region it receives lymph from? Right half of head, neck, thorax and the right upper limb and right upper. You can see right upper limb, right half of head, right neck, and the right lung, right side of heart, and the right surface of the liver. All this the lymph will drain into the right lymphatic duct. Okay, then the thoracic duct. See, all this region into thoracic drains the lymph from both the side of the lower limb, pelvic cavity, abdominal cavity, right side of the thorax, right side of the head, right side of the neck, and the the left side of the thorax, and the left side of the head and the neck, and the left upper limb. So all this will be draining into the thoracic duct. So remember, right lymphatic duct and the thoracic duct, which are the drainage channel. Okay, lymphatic cell, also called a lymphoid cell, located in both the lymphatic system and cardiovascular system, work together to elicit an immune response. Types of lymphatic cells are macrophages, epithelial cell, dendritic cell, and lymphocyte. Okay. There are, next one, we look into lymphatic organ. Okay, lymphatic organs are arranged in two groups, primary organs and secondary organ. Primary organs are called a red bone marrow and thymus gland. Secondary organs are called a lymph node, lymph nodules and spleen. Okay, they are the lymphatic organs. Lymph node, you can see the dotted and all what you're seeing, all the region, they are all the lymph node. The lymph node are more prominent in the region of the arm of the pit, inguinal region, they are very prominent. Okay, so what are these lymph nodes? If you look into the lymph nodes, okay, lymph node, they are small or round or oval, located along the pathway of lymph vessel, length from 1 to 25 millimeter, typically found in clusters. You see, they are found in clusters. You can see in the armpit, they are found in clusters. Receive lymph from many body regions. Lymph nodes are also found individually throughout the body tissue. So these are the lymph node. Okay, what you're seeing bean shape, this is the histological slide you're looking. So in the figure here, you can see how the lymph node are arranged. Okay, lymph node, bean-shaped body with efferent vessel entering at periphery and efferent vessel emerging at the hilus. Okay, arranged in groups along the blood vessel or the flexural side of the joint, divided into two groups. They are called as the superficial and the deep group. So you can see the here the region. Can you see the breast? Okay, region and lymph node is you can see here the lymph node of it where it drains. Region lymph node is a lymph node where lymph of organum partly. You can see here these are the regional lymph node what you are looking. There are different, okay, axillary node, inguinal node, thoracic node. There are different nodes you are looking. Next is a lymphatic organ you are seeing, that is called as the spleen, which is a graveyard for RBC. Okay, where it is located? It is located in the abdominal cavity. What is the function of it? It is a graveyard for the RBC, means the destruction of the RBC is done by the spleen. Next, the thymus. Okay, you can see the heart. The heart here you see a lymphatic organ, thymus. Consists of two elongated lobe. Is a large organ in fetus. It is very large in fetus, and it undergoes a smaller in size as the growth on. Occupies the thoracic cavity behind the sternum. Secrete lymphopoietin. It secretes the lymphopoietin. Okay, lymphatic nodule, oval structure of lymphatic cell with some extracellular matrix that are not surrounded by connective tissue capsule. Filters and attacks antigen. In some areas of body, many lymphatic nodules group together to form a larger structure. They are called as MALT. Okay, MALT means mucus associated lymphatic tissue or tonsil, very prominent mucus of small intestine, or pair patches. In the appendix and all, you see they are called as the pairs patches. What are MALT? Mucus associated lymphatic tissue, pair patches, tonsil and appendix, digestive. Lymphoid nodule in the walls of bronchi respirator. MALT protects the digestive and respiratory system from foreign matter. Tonsil, cluster of tonsil, cluster of lymphatic cell and extracellular matrix not completely surrounded by connective tissue capsule. Okay, consist of multiple germinal center and crypts. Several group of tonsil form a protective ring around the pharynx. See, around your pharynx or the mouth cavity, they act as the first line of the defense. Okay, so there are four groups of the tonsils around it there. They are called a pharyngeal tonsil, palatal tonsil, lingual. The first line of the defense. See here, oral cavity. Look, there are first one defense. Okay, they are called as the tonsil. They are mucus associated lymphoid tissue. Okay, this is about the lymphoid organ, no, the lymphatic system. So, what is the applied anatomy of it? You will see lymphangitis, inflammation. You can see the inflammation of the lymphatic vessel. Commonest cause bacteria called streptococcus. Lymph vessel appear as a red streak through the skin. You can see that is lymphangitis. Filaris, okay, filaris. You see this case filar, this is the larva, the larva maturation adult worm and spread through the lymphatic vessel where they mate and lay eggs. See, this is a filaris case you have seen, that is the lymphatic vessel. Okay, lymphedema, you can see here lymphedema occurs due to accumulation lymphatic fluid in the interstitial tissue, sometimes can be appreciated after wearing tight clothing or jewelry on affected limb. Okay, this is about the lymphedema. Lymphadenopathy means a disease of lymph node. See, you can see the enlargement of the lymph node here. Okay, you can see the enlarged lymph node becomes swollen, enlarged, and may be painful to touch. When you touch, that will be painful. Okay, you can see the difference between normal lymph node and enlarged swollen lymph node there. Okay, lymphomas. Cancer originating either from lymphocyte in the lymph node or in lymphatic tissue in organ. Risk factor HIV, hepatitis, all on you see lymphomas. Okay, you can see the lymphoma here and all. Tonsillitis. You can see when you catch a cold, you see your throat. Okay, that is because of the tonsillitis condition you are looking. So infection of the pharyngeal tonsil, you see, that will lead to tonsillitis. Tonsil are swollen, fever and pain during the swallowing usually present. When you catch a cold, you can see the tonsil, the throat pain, that is because of the tonsillitis you are looking. Treat, or when it becomes more, the infection or more, that is called as tonsillectomy, that is a surgical removal of the tonsil. Okay, that is called a tonsillectomy. Splenomegaly, that is an enlarged or the spleen, you see, that is a spleen. Various cause might be there. Okay, this is about the splenomegaly. So in the, just know in the lymphatic system, like what are the ducts. Okay, like right lymphatic duct and the left the thoracic duct, the main thing. Okay, where the lymphatic drainage occur in your body. So right lymphatic duct, which are the drainage channel, and the thoracic duct, what are the drainage channel, just know about it. And about the which are the lymphoid organs. The lymphoid organs are classified into groups like primary lymphoid organs and the secondary lymphoid organs. Just know the names of the primary lymphoid organs and the secondary lymphoid organs, what are the names of it. Okay, just know about it. And the applied anatomy of what will happen of this system. Okay, okay, this is about the class. Okay, thank you.